Have you ever experienced an emotionally traumatic event? Have you ever gone through job loss, divorce, or maybe something even as simple as moving to a new area? If you have, then you've probably experienced depression. It's something that everyone goes through, and is an understandable response to emotional stressors that cause strain on our lives. However, one must ask, what happens when depression goes outside of the normal bounds? When it appears without cause and does not seem to go away? Hello, and welcome to the Psychological Inquirer. In today's program, we will be taking a journey into the world of people who suffer from major depressive disorder. The leading cause of disability in the U.S., more than 14 million American adults suffer from this disorder, or approximately 6.7% of the population. What does it feel like to suffer from major depression? What are the causes, and how can you be helped? We will discuss all this and more in the Psychological Inquirer. This is the story of Natalie. She's been depressed for 7 years and is now, slowly, getting better. Major depressive disorder is the most prevalent of the mood disorders in the U.S. People with major depression often report similar feelings of a persistent sadness or emptiness. Feelings of hopelessness and pessimism are often present, as well as frequent reports of irritability and decreased energy. The beginnings of depression in Natalie are consistent with the majority of major depressive patients, sometimes starting off with a missed day at work at the office due to no energy, accompanied by sadness. The conditions can quickly worsen into full-blown chronic depression, and therefore overwhelm the patient.
So Natalie, how did your depression start?
Well, it was one day I woke up and I felt like I had no energy and I just didn't want to get out of bed, so I called in sick and I figured it was just one day, and then, the day just went by so slowly, and then the next day I did it again. I didn't want to go into work. I didn't want to see anybody. My fiance was calling me. I was ignoring all his calls. I was just ignoring everybody. And then eventually I lost my job, and then my fiance left me, and it just felt like everything was out of control. I always felt like I had no energy. I never wanted to eat. I just wanted to die. I just wanted to lay there, not do anything at all. I felt like the world was coming down on me, like the world was against me.
So I'd like to re-elaborate how you felt when the disease first started coming on.
I initially felt like I had no energy, and it just started like smaller bouts of sadness, and then it got worse.
And then how did you start to feel after treatment?
After treatment, I started to notice a gradual improvement in my mood. I started to feel like I had energy again, like there was life to me again. Before I felt like I was just dead, so to speak, and I was feeling more revitalized.
Common symptoms of depression are obviously decreased mood, and other changes such as changes in eating and changes in sleeping habits. As shown by Natalie, she would eat less and sleep more, causing a general decrease in energy. She also displayed anhedonia, which is a lack of pleasure from life. Then, since the lack of eating and the increased sleep, she also had decreased levels of energy, which caused a loss of her job. Cognitively, depression has its roots in negative self-schemas, and also an internal locus of control. This means that when someone has an event such as a bad day at a baseball game, where they maybe don't perform too well, they'll commonly blame it on themselves instead of situational factors like maybe it was raining or the other team was simply better. In other cases, when they do something good, for example, getting a good grade on a test, they'll commonly say that, oh, the test was easy. It is pretty much a recurrent pattern of self-blame and belittling oneself that causes depression. Do you blame yourself for these events that happened to you?
I did at the time. At the time, I thought that, I lost my job because I was a bad employee and no one would want me. I thought that my fiance broke up with me because I was just a horrible person. Everything I did and every bad thing that happened to me, I felt like was because of me.
Common etiologies of depression, or causes of depression, can be linked to genetic factors. For example, if one of your parents or one of your siblings has depression, you're at a higher risk of having the same disorder. The prevalence rate in the population is about 6.7%, but the concordance rate between monozygotic twins is approximately 50%. Another root of depression is a low neurotransmitter called serotonin. Low levels of serotonin cause a decrease in mood. Life stressors also have their effects on depression. For example, when Natalie lost her job and her fiancé left her, it would cause her to continually blame herself. It's a life stressor. We can look at this in the diathesis stress model. The diathesis stress model is a ranking of genetic propensity and life stressors that both coincide to cause depression or another disorder. For example, if Natalie had a genetic propensity to have depression, when she had her life stressors, for example, losing her job or her fiancé leaving her, they would work together to cause her disorder. Natalie, did anyone in your family suffer from depression?
Actually, yes. Depression is very common in my family.
And were there any particularly stressful events that happened prior to the first onset of your depression?
Well, I had actually just gotten engaged, but at the same time, my father had just died, and I was very close to him, so that was very hard for me.
I remember you talked about losing your job.
Yeah, I actually did end up losing my job as a result of the depression because I would keep calling in sick, and after a while, I guess, my employer just didn't want me anymore.
There are multiple ways of dealing with the symptoms of this disease, the two biggest being electroconvulsive shock therapy and medication through SSRIs, or selective serotonin reuptake inhibitors. While both of these address the symptoms of depression, the most effective way to deal with the underlying problems and causes of depression is through cognitive behavioral therapy, or CBT. CBT is most often used in conjunction with medication, but oftentimes is not just an individual approach. There are many CBT programs that involve groups and have proven to be effective. Cognitive behavioral therapy seeks to address the underlying thought patterns within the patient. Too often with depressed patients, they have a negative thought pattern that leads to an unhealthy and inefficient perception of oneself. CBT, in conjunction with medication, helps patients to identify and change these negative thought patterns while trying to limit...
Natalie, what was your experience with therapy?
Well, I actually started off with cognitive behavioral therapy, CBT, in combination with some SSRIs and other depression medications.
And how effective was that?
The CBT was pretty effective at first. My doctor had me do different role-play exercise, activities where he would reward me for positive behaviors, and I think that had a huge effect in getting me over my depression. I also, with the SSRIs, I think that those definitely lifted my mood a lot.
But I heard when you first started CBT, you actually had a decrease in mood?
Yeah, the first time when I went into the CBT, it just made my depression worse, and I actually started missing sessions altogether. And they had to put me in ECT.
And what was ECT exactly?
It is an electroshock type therapy.
And how did that help you?
I think that it got me over that first, it helped me overcome the first step towards getting better.
And now you are on a combination of SSRIs and CBT therapy, correct?
Yes. And it's helping me tremendously. I do still meet with my therapist every week, and we talk about things, we talk about my life, and I'm learning to realize that not everything is my fault.
Have you ever tried group therapy, Natalie?
I have done group therapy a couple times, and I personally find it very effective. It's helpful to see that other people do have the same symptoms as me and that I'm not alone. I think that was a big part.
It helps you build a support network, right?
It does.